It's the patients that we serve. They're the people who have to make the decisions to put their faith and trust in us. So if we don't listen to our patients, then we won't get our services right.
Patients have direct experience of the care that they're receiving. They have direct experience of the condition that they're experiencing. So if we don't listen to our patients, we're not able to provide the right kind of services for them.
And I think now we're actually seeing that the patient voice nationally is quite weak. And that is what I'm hoping is that the conference will act as a springboard to a more galvanised patient voice.
The patient isn't simply a tumour site which has to be focused on by the surgeons and the doctors and the radiographers and so forth. It's a living, breathing person, and that person has feelings, and in the treatment of cancer, those feelings will be intensified, they'll be emotional, there'll be a huge range of problems which the patient experiences as well as the diagnosis.
It's incumbent on the NHS, the various sections of the NHS, to be asking questions as to how people feel, what the treatment is like, to get a good overview.
The service is for patients, and if we don't listen to patients, how do we know the service is shaped to meet the needs of patients?
Please use this day to make links, ask questions and learn more about what is happening around cancer services. Enable us to create a legacy from this conference which will perhaps lead to another event and support future patient involvement within the NHS on the delivery of cancer services.
This is quite staggering for me. I feel a little bit humbled, I have to say, and equally contrite. I'm 2 years in post this April. What I can say, the first year felt like salvage and survival.
I stand here with an understanding of what it's like to have a diagnosis and to lose people to cancer. So cancer's been in my life since 1979. And then we can do this, but John Travolta. Yeah. So you're laughing, good.
I think it's fair to say that probably over the last couple of years we've lost our way a little bit in this respect. So I think we've got plenty of solutions based on past experience that we can use and build on and re-engage.
I think the NHS should look to build patience in the routine day-to-day task, and the problem we have is we often think we should ask patients to confirm what we've done is okay, but what we should do is introduce them at the start of the process so that they know what the problem is and what the constraints are we're working with, so that they can help us build the solutions and make the decisions about how we go forward.
The old ways that we used to have disappeared, and we have lost something through that. The direct patient involvement coordinators who used to sit within networks. We've got to re-engage with patients, and some of that is about face-to-face work. Some of that is about using the newer technologies that are available and using those things that reach out to people from 0 to 90, and that's going to be different across the age range and across cultures as well.
I've got a series of questions. So the first one.
We know that England has poorer outcomes for most cancers than other European countries.
I'd come back on that and I'd say if we look at what we have as variation within our own country, let alone comparing to other countries, I'd really like us to have our own house in order.
It was announced last week that Manchester is going to benefit from this, and it might well be rolled out elsewhere in England.
That would be my key as a patient. That's what I want to know. Can I go to where the treatment is?
How can we ensure survivors can continue to play a productive part in society?
Coming back to the word holistic, and I think as any clinician or any health professional involved in supporting cancer patients, and we know there's going to be 4 million cancer survivors by 2030.
So this conference came about from our patient partnership group, so we mobilised into action around that. They came up with the ideas.
From my perspective, I think it's really important at a very local level that they engage with the health and wellbeing boards and with local health watches to ensure that there is a strong voice at many levels into the system. Equally, in terms of service design or changes that are going on within their own environment, again being involved through clinical networks, for example, going forward in the future will be equally important. been a really, really great day. It's flown. It's, you know, for a day-long conference, it's just been so buzz right through. So I'm going to finish by saying a huge thanks to John, Stuart and the team around him. They've done something that we should have done before, so well done.